Hey, OncoPT, and welcome to this episode of the OncoPT podcast. Now, let's check in a minute because it's been a while since we've done one of these. So, first of all, this is the first solo episode that I've done in probably like a couple months. And it's because I've been literally so overflowing with amazing interviews that I just didn't see the need to also put in a solo episode. So we are getting back into the routine. I also do a big promotion around CSM where I interview speakers and panels on their topics because y'all know CSM is like my second Christmas. And I finally have worked through all of that content that I like batched up to this point. And it's been a minute. So I'm really excited to be back here with y'all. And I also wanted to do a little bit of a life update. We really haven't chatted a whole lot about this. I haven't been really on social media lately, and it really comes from CSM was amazing and also exhausting all at the same time. And right at that time, I was also diving in to getting my signature course, Case Report Writing Workshop, up and ready. And there is some revamping that I was doing behind the scenes. I have some brand new interviews that I've done with past students, one of which you have already heard with Cherie King, and I've actually got a couple more coming down the pipeline. So there's just been a lot of behind the scenes stuff that I haven't been talking about lately because I've really had my blinders on, for better, for worse. You may also hear that I'm sounding a little different today. I got sick for the first time in a really long time this past week, and I'm so irritated about it, to be honest. I am so blessed. My health has been so good, genuinely. And I really haven't gotten sick. Even when I've been sick, it's been very mild. And so this past weekend, it was a very big roller coaster of I felt poorly. And then there was literally a day in the middle where I felt 100% better. And then I kind of backslid a little bit. And then I was back to being sick. Anyways, I'm on the up and up now. I'm fine. It was just a cold or something, whatever. But it was just really annoying and inconvenient. And I feel like that just kind of added to my train of chaos that I've been in. So, anyways, we're here today. I'm so excited that you're here. Let's get real. Let's chat because there's a lot to chat about. And one of the things that I'm really going to hit you over the head with, the first part of this episode, is that for the first time ever, genuinely, in human history, as far as I know, we are expecting that more than 2 million Americans are going to be diagnosed with cancer this year alone. We have never, and again, as far as I'm aware, we have never anticipated, expected, estimated, projected to have this many cancer survivors hit with a new diagnosis. We have never had this many Americans at risk of developing cancer and being diagnosed with cancer in this year alone. And previous reports have always kind of bumped up against this 2 million marker, right? And it's significant. That is a lot of people. That is like if all of Fort Worth and the surrounding areas were suddenly diagnosed with cancer today, just to kind of put it in perspective of a numbers game of what we're really talking about. But we have never surpassed this 2 million expected diagnoses mark until now. So earlier, this is not a new report, but it warrants bringing back up again. The American Cancer Society released their Cancer Facts and Figures 2024 report. And in this report, they estimate that 2,001,140 new cases of cancer will be diagnosed in the United States in 2024. And that's a lot. Like I said, I've already given the Fort Worth, numbers game that we're talking about here because that's where I geographically live. That is a lot of people. That is millions of people who are facing a brand new cancer diagnosis this year alone. And that is staggering. It's very, very concerning. But the good news is behind this is that we have better treatment than we've ever had previously. We're able to treat and cure more cancers than we ever have up to this point. And all of these things are really good news. But while treatable and while sometimes curable, cancer is still a really, really really big problem. And it's becoming a bigger problem than what we've seen previously. Again, because more people are being diagnosed with cancer in this year. And that also already adds to the, I think 18 million Americans who are cancer survivors living in the United States in this day and age right now. Like, it's absolutely mind-boggling to think about that many people are dealing with this. It's crazy. So again, I know sometimes that we tend to think of, well, it's, people are living longer than ever with cancer. Yes, amazing. These are facts. These are true. But while survivors are living longer, we are failing to consider a lot of times at what cost. At what cost to their life, their livelihood, their job, their independence, their function, their mobility, their quality of life. At what cost are people living and surviving after a cancer diagnosis for longer periods of time? And PTs are perfectly primed and positioned to take the lead in what needs to happen for these individuals who are diagnosed with cancer, who have experienced cancer, who are being treated for cancer. We are in the perfect position to step up and help treat and care for this rapidly expanding patient population. But this requires a lot from you. And hey, I'm talking to you. Okay, we're not talking in abstracts. We're not talking in the hypotheticals. I'm talking to you, the listener, who is listening to me in your ear right now talk to you, because this is a big deal. And I need you to slow down, stop if you can, and pay attention to this. This being perfectly primed, this being perfectly positioned requires you to step up and really command the understanding, the grasp, the knowledge, the information, really command your expertise in the oncology patient population and what it takes and what it means to care for a person who has cancer. This requires you to step out of your comfort zone as a physical therapist and step into and up to being a confident, competent onco-PT who truly commands your expertise in this field. And I know when I say this gets so much pushback, okay? But I'm really going to break down today exactly what are some of those barriers that you may be experiencing, that a lot of us experience on our way to becoming a specialist, and how we're ultimately going to overcome these. Because now is the time, like if there has ever been a time in history where we need you, the Onco PT listening to this podcast right now, to step up and deliver for this exploding patient population, it's now. Okay? The numbers don't lie. We're there, right? We have to be able to step up and care for this patient population. The time is now. Okay? So let's get right into it. I know the instant that I bring up specialization, I can already picture what you might be doing. And this is, listen, I've done all these same things, okay? But I know that when I mention specializing in oncology, you probably roll your eyes. You probably maybe cringe a little bit. Maybe you grind your teeth. Maybe you burst out laughing, thinking about all of the ways that you have to go uphill both ways to try and actually specialize as a physical therapist, right? And we're not just talking about in your job as a physical therapist, like your profession, but also all of the logistic obstacles that come with trying to specialize in addition to being a working professional and a member of a family or a community, and also a human in all of this, okay? I get it. I truly, truly do. Specializing in oncology is one of the most challenging things you will probably do in your career, in your profession, excuse me. Full stop, period. Okay? And to add to that, I'm biased, but I think a lot of you listening to this would agree with me. Add to that specializing in oncology specifically is one of the hardest specializations in physical therapy. And we could get into this all day, every day. It's one of the newer ones. Okay, so that's an aspect of it, right? There's also not a lot of oncology physical therapists out there compared to, for example, ortho, sports, neuro, etc., right? And that's nothing against them. It's just more PTs choose to practice in those areas than in oncology. Okay, we get it. But on top of that, oncology is a area that requires so much nuanced thinking and requires you to know a lot about a lot of things, right? I did an interview with Dr. Katie O'Bright a couple weeks ago, and we talked about in primary care, your scope of practice is really 3 miles wide and 3 feet deep. So you have to know a lot of things, right? A wide breadth of things, but not necessarily a huge depth of things. And I think oncology can be challenging because it seems like we have to know a lot about a lot of things. So it's wide, but it's also deep when it comes to truly understanding what needs to be done for a person who has cancer, right? How can we, as the physical therapist, make a positive impact on this person's existence after they have been diagnosed with cancer, which already affects their body? And then we have all these treatments that have all these side effects, yada, 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 right? So let me just say this. I understand why it can seem so challenging and frankly sometimes impossible to specialize in oncology, or to maybe explain away why you don't want to specialize in oncology. But if we are really going to show up fully for our patient population who have been diagnosed with cancer and are getting diagnosed at increasingly alarming rates, this isn't even to mention how many young people are being diagnosed with these cancers that we did not historically think were young people cancers, right? Like, the time is now. It is a big problem everywhere. Everybody is suffering, and we don't have enough people to help take care of these individuals in the way that they deserve to be treated for. Okay, so I get it. Oncology is a lot, but it's also extremely, extremely worth it to elevate the care that we are providing for this patient population, not just very locally, like maybe in these big cities that have these big hospital systems and, the latest and greatest, etc. That's not what our patients need. They need someone who knows what the heck they're talking about and how the heck they're going to help them with whatever issues they're facing secondary to their cancer diagnosis and cancer treatment. So let's break down some of these barriers that I know some of you are facing when it comes to oncology specialization. Number one is lack of exposure or experience in OncoPT. Let's face it, many physical therapists do not have any exposure to oncology in their education and their training, period, right? For me, I went to PT school and graduated in 2018, which is not that long ago in the grand scheme of things. Cancer was a one lecture situation in our pathology class, which, okay, good, but it was more like, this is cancer and these are the different types of cancers that a person can have. And that was kind of the conversation, right? And then later in our curriculum, we had an optional opportunity to do a special topic crash course lecture in oncology. And personally, for me, it was great because Angela Wicker Ramos, who I know y'all know and love, was actually the one who taught this particular lecture at my university. So, like, I was pretty blessed that I had that. And then I also had a clinical rotation in oncology. That is so rare. And that is so not the norm when it comes to physical therapy programs, right? We're very aware of this. And it's the same for other rehab disciplines, right? Unless you go to a school that has someone like Angela Wicker Ramos, like Scott Capozza, like etc., insert name here, you're likely not going to get this kind of experience or exposure in school. Okay, so like X, that's already a problem. That's already a mark working against us. And then again, once you actually get out into the practicing real world, unless you're in a facility that has a long established cancer rehab program, you may not see much of patients with cancer going through cancer treatment in your daily patient care. Except you probably are. And I really want you to think about this quote, which is, you may not see these patients but they see you. I just want that to hang in the air for a little bit. You may not see these patients, but these patients see you. And I think it was Nicole Stout who said this to me, or I heard her say it first. And it really did stop me in my tracks. Once I stopped, like with the wheels spinning in my head, the cogs turning long enough to actually hear what she was saying, I get the profound nature of this statement now. Even though you may not think that you are practicing in cancer rehab, you're not seeing patients with cancer all the time, you most likely are. How many of your patients that you encounter in a day, a week, a month, a year, etc., have a history of cancer and cancer treatment? If we think about the fact that 2 million plus people are going to be diagnosed with cancer, estimated in 2024, plus we've already got 18 million, probably more cancer survivors living in the US, the likelihood that one of your patients, if not like a whole bunch, who you see in any whatever situation that you're working in right now, the vast majority, I would say maybe not the vast majority, the likelihood that you are seeing patients and treating patients who have a history of cancer, who have a history of cancer treatment, is probably pretty significant. And it's probably a lot more than you are giving yourself credit for, but also really looking into just how many of my patients are actually dealing with this. You might be thinking, Elise, just because I've seen some patients who have a history of cancer doesn't mean I actually know what I'm doing, like how to be an expert in all of this. Friend, I have a podcast that you're listening to right now with almost 300 episodes released over the past 5+ years now, maybe more. I can't remember honestly. I have shown you how to treat patients with cancer. You are doing that right now. You are implementing what you are learning into your own patient care. You know what you're doing. You really do. And if you don't think you know what you're doing, I'm going to challenge you. I'm going to push back on that because I think you know more than you are giving yourself credit for. I think you are helping patients get better a lot more than you are letting on to yourself and maybe to others in your sphere, right? You don't have to do a residency in oncology to get started on this path to specialization. You don't have to do a clinical rotation in oncology specifically to get started on this path. If you are a PT and you care about helping patients live their best lives, including after a cancer diagnosis, then you absolutely have what it takes, okay? You have the exposure, you have the experiences. And if you don't think you do, I want you to re-examine what you've done and come back to me on that, because I'm going to wager you actually have a lot more experience and exposure than what you think you do. Now, the next barrier to this is feeling this uncertainty that you have what it takes to be an expert in oncology. And I think this one is loaded and I'm really, really excited about it. And again, this kind of comes back to, I'm going to push you on, if you don't think that you have what it takes, if that you know the information necessary to do this, if you're even considering that, I think that you know a lot more than what you're letting on. So one of my, now as like a early mid-career clinician, I don't really know where I fall yet. I'm still discerning that. But one of the things that they talk about when you first start practicing as a physical therapist is you don't know what you don't know until you don't know what kind of situation. You don't know just how little you know until you've been made aware of it. And maybe that's through a specific patient case, right? You have a patient who comes in and they say, I've had this, this, and this done, and you don't know, this is my personal experience here. You don't know what a pelvic floor exenteration is, let alone how it affects your patient's functional mobility. Okay, that's me. That's me. If you're watching this on YouTube, you know that I'm pointing to myself right now. That was me. I'd literally never heard of this procedure before, didn't have a darn clue about what it was, how it affected my patient's function. Turns out it was a lot, but that's a different story for a different day. I thought I knew a lot. in that moment until I came across that patient and said, I don't know what the heck this thing is, right? But now, if you're at the point where you think, gosh, I don't know, I just don't know if I know what it takes to, do this or whatever. If you're at that point of like, gosh, I don't know if I have what it takes, I don't know if I know all the things, you probably know. You do know enough information to get started with this. And I would really challenge you. If you're like, I don't know, there's so many diagnoses, there's so many treatments, there's so many side effects, it just seems impossible. Well, so is eating an elephant in one bite. But we all know that the best way to actually eat an elephant is one bite at a time. And that's how we're going to tackle oncology specialization, right? One bite at a time, one step at a time, one day at a time. Because specializing in oncology is an endeavor. And I really want to say a marathon, but I don't even think that's correct because a marathon does, it's 20 plus miles or whatever. Clearly, I've never run a marathon. But I like to think of oncology specialization as like an ultra marathon or a triathlon where they swim for 100 miles or whatever, something crazy that I will never do in my own life. This is the kind of journey that you're on. And I call it a journey very intentionally, very on purpose, because this is not an overnight transformation that you're going to say, I'm going to cram in a weekend, and then I'm going to come out and I'm going to know exactly what to do with my patients. And then whenever I choose to take that exam, I'm going to know exactly what's coming my way. This is a journey designed to take practicing clinicians, months, maybe even years to get to the point that you have what it takes. So again, I really like the kind of phases of learning or understanding or expertise that we learn about, which is as a novice, you are dumb. And I say this with love because I am still sometimes a dumb novice. Depends on the topic. But with this, you're confident in what you know, and you don't actually know what you don't know. And then there's a period where you come out of that and you think, oh my God, I actually don't know anything. So then you're taking in all this information. And I think this is where the real growth, as a clinician comes out, because you are very uncertain of like, I don't actually know that. I don't know if I know that. And so you spend so much time trying to drink from that fire hydrant that we talk about in PT school, of just trying to soak in by osmosis sometimes of what can I try to learn? What can I try to fit into my brain? And then you're going to come out of that. And you're going to come out of that period of just trying to consume all this information at once and then say, okay, I think I know this stuff. Let me try to actually implement it with my patients. And this is where specialization comes into all of this, because it's a great way to check what you have learned along the way and identify, what do I need to keep working on? What do I need to keep spending time in so that I can really show up better tomorrow or next week or next year for my patient who's going to come in with XYZ? Okay. So I really don't want you to get caught up on these barriers that we've been talking about so far, because that is most often a protective way that your brain is like, I don't know if we actually have what it takes. It's easier to not even think about these things if I just automatically excuse myself from the conversation, if I excuse myself from even considering this journey, this path. I want you to break down that defense mechanism, my friend, and realize that you have what it takes to show up every day confidently and competently as the physical therapist for your patient who's dealing with cancer. Now, I would be lying if I said that there was not an emotional toll associated with an accompanying specialization journey, okay? It's a big challenge, but I know you're up for it. I know that. When I started my own specialization journey a few years ago, this is actually when I was coming out of my burnout. And I didn't know it at the time, but specialization, the process of specialization, helped me kind of climb back out of the burnout that I was experiencing. So what was going on at that time? So it was 2020, first of all, when I started this process. The timing was just supreme of all of it. And I say that with so much sarcasm. So I was actually in the process of leaving my clinic job. I was starting a new job. And then there was a pandemic happening, which again, just all the things all at once. Not a good day for any of us involved, right? And the reason that I was really in the process of leaving this job, it was multiple factors. I was very unhappy, but I realized, especially as I was leaving and after I had left this job, is just how burnt out I was. And then I was diving into specialization, and I really thought, this was probably a really bad idea. I don't know if this was a good idea, but I've already started it. I'm just going to commit to it. And I found myself enjoying reading articles again. I found myself excited to learn again. And again, I think this kind of comes back to I had no idea how much I didn't know until I was forced to think about, I actually have to think about this and apply this. And so I really found myself enjoying oncology, physical therapy, and cancer rehab again after 2 years in the trenches of this is not what I thought it was going to be. It really forced me to reflect on past patient cases. And I did cringe. I was reliving as I'm reading and studying this information, as I was writing my case report. I remember thinking like, I really could have done this better. I really should have done this instead of that, right? So there was definitely some cringe that was happening as I was reflecting upon this. But one of the most surprising aspects was just how much I relearned to love the specialty, the specific area of physical therapy that I had found myself in. And so that when I then did ultimately open up my private practice, like a year or so later after all of this, I felt ready to get back into patient care. I'm going to let you know, I actually, like in the job that I took between when I left my clinic job and when I opened my private practice, was actually not in physical therapy because I didn't even know if I wanted to be a part of it anymore, which is so crazy to think about. But I think specialization for me was what really resoundingly reaffirmed my decision to be in oncology physical therapy and why I chose to get back into it after even leaving it for that year process. So emotionally, that was interesting. I was not expecting that, but I think it really goes to show up just how much of a transformative process this is. And I'm not even talking about the exam itself, right? Just the preparing for my case report, for the exam, is what really transformed me into the best possible clinician that I could be at that time for my patients. And it's continuing to inform me now as I'm going through the maintenance process, et cetera, as I've, been a few years in my private practice, as I'm trying to figure out how can I better show up for my patients? What is the next step that I need to be taking in my community to ensure best possible patient care? It all started with specialization for me. And I know that if you have any inkling that you want to be the best possible clinician for your patients with cancer, this is the way, right? This is the journey that you have to take to ultimately become that super confident and competent clinician who can walk into any situation with a patient and know, I may not have the answer right now, but I know what to do to get started. And I know what to do to help this person. I firmly believe that with all of my being. That's why I spend so much time talking about this. And this is why I'm so passionate about this, because I've seen the transformation not only in my own life, but also in my students who I help along this journey, who I coach along this path to becoming specialists, experts in cancer rehab, which is why I'm so excited to introduce and announce I have a brand new webinar that I just recorded. Actually, I had to record it twice because it completely broke on me, and now I have fixed it. So hallelujah, it is ready. It is here. It has been perfected because I've recorded it twice. Is called the 3-step framework for a finished case report. And this is my masterclass where I am taking you through exactly what you need to know in order to start and finish your oncology case report, as well as the extremely common mistakes that people make along the way as they are trying to write their own case report. So you can register for that now. I have included the link in today's show notes as well, but you can also go to the oncopt.com/framework and you will be able to find that webinar. It is completely free. This masterclass is completely free for you to register for and watch. And I also tease in there some of the very special behind the scenes stuff of my signature program, which is the case report writing workshop, where I take you from a blank screen to a finished first. So in short, in sum, the time to specialize in oncology physical therapy is now. Not just from a perspective of the deadline is coming up for this exam cycle. Okay, yes, we get that. We are at a precipice of having more people diagnosed with cancer than ever before in human history. We are at the cusp of more people experiencing the long-term side effects and impairments after cancer and cancer treatment than we have ever had to deal with as a society, as a culture, up until now. Like, this is literally the first time that we are kind of doing this, in a sense. And we are largely overwhelmed and unprepared to do this. And that affects our patients. That negatively affects them worst of all, beyond our physical therapy profession, beyond our, like ourselves as onco-PTs. This is absolutely affecting patients' lives, their function, their mobility, their independence, their quality of life, their ability to show up to work, to care for their family, to walk their dog, to volunteer at their, local community garden, whatever that is. This is affecting people's lives more than we have ever seen in human history. The time is now, and it is really on you to step up and make the decision. Are you going to show up as the expert for your patient or not? Whatever you choose, I'm here to support you, friend. But I know if you want to be the person who shows up for your patient, like we've been talking about, then you will register for this brand new webinar. Again, this is my free masterclass called the 3-Step Framework for a Finished Case Report. You can find that at the oncopt.com/framework, and I cannot wait to see you over in that masterclass. Until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patient with cancer needs. So let's get to work.